Thank you guys, and welcome again to our Thursday testimonial. We have an incredible testimony today. Dr. Kristine Parikian, she is from California, and she shares with me, we love this doctor so much. She's given us so much knowledge and wisdom from what she has gathered throughout all her years of practices. As I sent the invitation to you guys earlier, she's got a list of accreditations, guys, and we're just so blessed to have her here. So please give a silent welcome to Dr. Kristine. Take it away, Dr. Kristine.
Hi, everyone. I'm so happy to be here. Finally get to share all the little pictures and videos that I share with Ed every time I get excited in the office, which is pretty often, but sometimes I feel like I'm overwhelming and just constantly sending, beautiful pictures of people feeling so good after just one little placement. Yeah, thank you for having me.
Oh, it's my pleasure, Dr. Kristine. We'll have a lot of videos, and you know what, you do not you can send me as many videos at whatever times of hours, it doesn't matter. We really treasure them. Sister Vicky and I, we looked at it and you're like, oh my gosh, that just touches my heart, because you see the quick response and how wonderful this technology does to our body. So if you want to, why don't you tell us a little bit about yourself, Dr. Kristine?
So I'm an acupuncturist, but I also specialize in functional medicine. I'm also a clinical nutritionist and an herbalist. My doctorate degree is in herbology, actually. So I've been in practice since 2004, coming around 20 years soon. I love what I do. I just really love my job, and I just feel so blessed daily when I walk into that office and say, oh my gosh, I'm so happy to be here. It's I just feel honored to be doing what I'm doing and helping the people that I'm helping. That's a little bit about me. Yeah.
That's great. So tell us how you came across this technology in this company.
Oh my gosh. So last year in January, my mom had trigger toe surgery, which left her in a boot for about 6 weeks. And then I took her in to get the boot removed. When she stood up, she was unable to put any pressure on her knee. During the surgery, they had damaged something, nerve in her knee. Lo and behold, my mom is really young. She's 66 years old, was unable to walk. I work in a pain management clinic, so I have the privilege of having all kinds of doctors in my clinic. I work with an orthopedic surgeon. I have a doctor of osteopathy, a chiropractor, a physical therapist. We've got it all. It's an all-inclusive pain management center. Needless to say, I tried doing acupuncture, didn't work. We did chiropractic adjustments, didn't work. Eventually, I had her go to the doctor of osteopathy and have trigger point injections. That didn't work. We did PRP. That didn't work. She was still in pain. We were still pushing it around in an office chair around my house. My mom lives with me. So this became like a huge burden on our family, because my mom is like my backbone. She picks up my kids. She does all kinds of stuff for me. Now I had to wake up super early to get her to work, bring her back. It just became a nuisance. So I was having lunch with Kelly, who introduced me to the patch. And I was just so frustrated because I had done everything I knew to do and more, everything I wouldn't even want her to do, like injections and all that. I tried not to get a patient to that point. Here's my mom, and I'm like completely helpless with her. So, I was like, I started crying. I was like, I don't know what to do with my mom. Like, this is going on 3 months now, and she's just miserable. She said, oh, she has a British accent. I have this patch somebody gave me. You want to try it? And I was like, anything, fine. Came home. I didn't even know what I was doing. She said, put it on where it hurts. I said, how? She goes, I don't know. I don't know anything about it. Just put it on somewhere. I said, where it hurts. I said, okay. Came home. I had just Aeon and Icewave. So I put those, I think it was Aeon and Icewave. I don't even remember. Put them on, and I just went to go cook dinner. And within 10 minutes, my food was ready. I called my kids to come to dinner. And I turned around and my mom was sitting at the dinner table. And I was like, oh, who brought you here? You know, usually one of my kids pushes around in the house and she's like, oh my gosh, I can't believe it. My knee, it doesn't hurt anymore. I was like, sit down, sit down. Like I was paranoid because she's going to break a hip if she falls, you know? As I told her, I said, this is placebo. Like you can't like try to attempt to walk right now. You know, this is really dangerous. Don't do this. Don't move. But she's like, but Kristine, I feel great. My knee doesn't hurt. And needless to say, she didn't have any more pain that day. So I was like, so now what? What do I do? Where do I get these patches? I call Kelly and she's like, I don't know. I don't have any more. And I was like, so what do I do? She's like, let me call you back. So she's like, you can become a distributor. You can order it. I was like, get me in. I don't care what it is. I don't care what it costs. I just need this woman to be walking. Like we need her stable and functional. My mom literally patched for less than a week and she never needed the patches again. She's never had to use the patches on her knees. Now she uses patches all the time, whether it's her shoulder, her neck, her back, whatever. But the mere fact that a patch, as holistic as it can get, completely stopped the pain that was in her knee and allowed that inflammatory process to be completely resolved within minutes, max. I don't even know, it was maybe 5-10 minutes. It was a sheer miracle. So I was sold, but I was also not sold. I was very skeptical. I was like, I don't know about this. We'll see how it goes. So needless to say, I was stuck with a lot of patches because I got in as a diamond right away. I was like, I don't care what it is. Just, and all I had ordered was what I had used on my mom. So it was Aeon and Lifewave and X39s. That's it. Took the patches to clinic and patched every single patient that walked through the door for the next few months. And it was one after the other, after the other, after the other. And it was just, I was done. I was like, okay, this stuff really works. That was it.
Wow, that's incredible, you know, because we have a tendency to try something new, and if it works, it's sometimes it's too good to be true, right?
Right. Yes.
And so our mind is not ready to receive that. Like even pain, because you know you're a professional at what you do, right? So you have a lot of patients. Like at one time you told me you have like 20 to 30 patients that you see like every day.
In a day.
I mean, can you imagine?
And I don't work full days. I work 9 to 2 or 9 to 3 because I pick up my kids.
Oh my gosh. So can you imagine just the volume, the sheer volume of people that she sees every day, you know? So yes, she ran out of patches real quick.
I did.
But it's wonderful because now you have a tool in your arsenal, right?
Yeah.
That you can administer to your patients and that they can get, and it can help them right away. So that is, when I heard that story, guys, I had to be like, we have to share this. And we've made a couple videos since then.
Right.
But you know, thank you again for coming in our channel to do this call, because I want to memorialize this, because this is truly incredible. So why don't we start with showing the screen some of the pictures that you send me. All right, I'm also going to share my audio. All right, we start with this one.
So this patient of mine, I was actually treating her knees. I don't know if you can look at her knee. You can see the residuals of the acupuncture points that I had used on her knee. And when she got up, I noticed that her finger was stuck. And I just randomly asked her, I said, what's wrong with your hand? She said, this patient had breast cancer. So this was a side effect of her chemo that had left her finger that way for the last 6 months. It's trigger finger, but it's also neuropathy as well. So this finger has been like this for 6 months. She's never been able to open it. She's had countless cortisone shots on it and nothing's able to help. And she was like one of my very early on patients that I tried the patches on. And I told her, I said, you know, I'm going to try to document this, but I don't really know if it's going to work or not, but let's try it anyway. So I placed Aeon on the back of her neck, and I placed the Lifewave patches on her hand, one directly on top of her hand and one directly on the bottom of her hand. And boom, the finger opened. within 30 seconds. I want to say maybe even less. She went ballistic. She could not believe it. She signed up right away, that same day. Yeah, so this was huge for me as a practitioner because it was something that was so remarkably life-changing for this patient. She couldn't grab her keys, she couldn't put on her shoes properly. Everything was difficult. Imagine like losing your hand, the function of your hand, and not only losing the function, but she had severe pain in it, shooting pain all the way to her fingertips. So this is one of my first wow moments. It's different when you see a patient's achy neck get better, and it's different when you see their lower back get better. But when you see a trigger finger unlodged like that, had I known this 6 months before I did this to this patient, my mom would not have been, in this situation that she was. But, God knows what he's doing anyway, regardless. With the one person, so many people have been touched. So there's a reason behind that too.
That brings me to memory that we have an aunt of ours, Tish, her name. She had trigger finger, and because you had shown me these pictures, it was like, and it perfectly makes sense because it is a bypass. Sometimes it's a byproduct of medication or other things that we do. Can't remember if it was you or Dr. Caroline that said that everything that we put on our body that's synthetic, it goes totally against our body. So our body tries to do something to.
Because we can't absorb synthetics, it becomes bio unavailable, which means it's going to get thrown into your bloodstream, and it's going to have to deposit somewhere. That was part of probably a calcification that happened in that finger, and it just got stuck and it wouldn't allow it to move. Trigger finger has a lot of reasons behind it. This was post chemo, so this was direct result of medication. But yeah, it was unfortunate that she was in so much pain for so long, but I'm so glad that she's okay now, and she's just doing beautiful right now. I don't even see her anymore because she doesn't need me anymore.
Well, that brings me to memories, and I don't know whether you want to share this with the group or not, but one time you called me about a lawyer. Do you want to share that story? And you don't have to name names or whatever.
No, I won't name names, but I see a lot of personal injury cases in my office. So I deal with a lot of attorneys and a lot of paperwork and just, a lot. So dealing with attorneys are amazing, but they're very difficult to work with specifically. And if you don't give them what they want, then they get very aggressive. So maybe, I don't know how long ago that was, maybe like 3-4 months ago.
Right.
So I was treating a patient from a referral from an attorney for low back pain. And he called me up one day and he said, okay, I'm not going to refer any more patients to you. And I said, why? He said, well, you're using these patches that are taking all their pain away, which means they don't want to do any more treatments and they're all better. And what's going to happen to these cases? We're not going to make any money. Like, this is not what we tried to do as business. And I was baffled. I understand where he's coming from. At the end of the day, there's a business aspect to it, and I appreciate that and I get it. But what got me, and I actually told him I wouldn't want to do business if that's how he wanted to conduct himself, is that he didn't care about the patient's well-being at all. Had he told me, like, maybe apply these patches towards the end of the treatments, let them get their treatments in and all that stuff, it would have been different. But he straight up told me, if you use these patches, I won't refer any more patients to you. So I said, okay, that's fine. I don't have a problem with that.
Wow, that's amazing. Isn't it incredible? Like, I know as a pastor, we don't take an oath, but our oath is to help people, right? To minister to people. And I'm sure you have something similar to that because you want to help your patients, right? So tell me, I had an instance similar to this with a PT that she loved the technology, gave me her credit card. She says, I want to come in as a diamond. Let's do this. It was one of my first clients. So I was really excited about it, only to stop. On the way home, she called me. She says, Ed, I can't do it. And I said, okay, why? She says, I'll call you later. So here I am waiting. I'm like, what did I do wrong, right? And she says, well, what happens is that I talked to the board, my board of directors in her clinic, and they're really, because of how quick this technology works, they don't want us to have it in the clinic. And I'm like, really? She said, I feel really bad. She said, she's a really dear friend of mine, but she said, I can't use them. I'm like, you can't use them because they're that good. Now that, and like you said, we understand where the, so it's a business, right? So you have to understand that there's money to be made in their business. And I understood her 100%. But to me, my question to you would be this, Dr. Kristine. Do you then fear that your business is going to slow down because you're helping your clients or your patients so quick?
Absolutely not. Absolutely not. If that was the case, I wouldn't be continuing to use the product. Brother Roy told me something though in the very beginning. Those first few months when I was introduced to the product, I was patching patients first and then doing acupuncture. And then when I told him this, he said, no, you're not going to do that. And he said, you're going to affect your business. And then, I didn't know much about the technology at all back then. I was just trying to see if this stuff really works. And so when he explained to me the fact that if I had done acupuncture on a patient first and then applied the patches, the effects were like 20 times better, if not 100 times better. It was more effective. Like, we can wait 30 seconds, 45 seconds. If I do acupuncture and then apply the patches, it's almost instantly. The minute I put that patch, there's an effect. So, that's what I started doing. As a matter of fact, I want to say my business has grown. It's been the opposite. I think God is so good that I don't believe it could go the opposite way. I'm telling you, like for that example, I don't see that patient because she uses the patches, which is fine. That's still doing what it does. But that word of mouth is all you ever need to do really well in practice. I've never done marketing. I've never done anything in the last, I don't know how many years I've been in practice. It's always been good faith, doing what you need to do as a physician to get your patient to where they need to be. And that's it. I mean, I think the rest is up to God.
That's
very simple. Very simple. It's not a complicated situation.
Thank you for sharing that, because we do have, as brand partners, we do have a lot of doctors that we see, like Vicky has a lot of doctors. I have one that I see maybe once every 4 or 5 years. Vicky's like, you better go to your doctor.
I know.
I said, I love doctors, but only Dr. Caroline, Dr. Kristine.
Oh, you're so funny.
Doctors.
You haven't called me Dr. Caroline today. I'm proud of you.
I'm careful. I talk to you guys all the time. And Dr. Caroline has been in a little vacation right now, so I haven't talked to her for a while. But thank you for sharing that, because as your business grows, the word of mouth, you did tell me that you don't advertise too. And I'm like, wow. So, for your business to grow, this is something that we can take, guys, to our clients and to the doctors and the functional doctors, practitioners that we work with, acupuncturists, that don't let them fear that they're going to lose business because they're using this product. Their business is going to increase because the word of mouth is going to be just ridiculous. Because how many doctors, you said that you have, like, what, how many doctors are in your office?
In my office, we've got 5.
Okay.
And I've patched every single one of them. And I really have. And they still come to me when they have headaches and aches and pains, but it's that fear factor that none of them will use it in the clinic.
Wow. So tell me, I want to go rewind a little bit about doing acupunctures, because there's something that you do. Can you tell us what you do with your patients? Guys, this is really, really incredible. I'm so glad that you're.
Which part are you talking about?
The 4 gates.
Oh, yeah. So if I have in mind that I'm going to introduce the patches to a patient, and here's the other thing, I never introduce the patch on the first visit. It's just overwhelming for a patient. They're just getting to know me. I don't ever introduce it to anybody until I build the trust with them, because they need to believe it. It's so unrealistic that they need to trust me as a physician in order to take my word for it. So it's usually about the third visit, I'll say, hey, how are you doing? Are you getting better? Yeah, I'm getting better, but I'm not 100%. Can I introduce something to you? Sure. And I always give options. I'm like, would you rather have something quick and easy, or do you want to do herbs and supplements, and which is also amazing. And I combine usually both of them anyway, but everybody always chooses the quick and easy, right? It's just quick and easy. But so if I know that I'm going to introduce this product to the patient, then I will definitely do their regular treatment, whatever I'm treating them for. And then I'll open up the 4 gates, which is Li4 on both hands and liver 2 on the feet. So when you open that 4 points up, it's like an electric wave going through the body. And if you leave that in for 15 minutes, it's an actual entire circulation of the chi in the body. So not only were we opening up all the gates and the meridians, we're inviting new energy in. So that's where my patches come in. So as soon as I place that patch, those points are so active at that point that it's instant. Usually it's instant. Unless somebody's got like severe other issues, then, then it's not.
So when you told us about the 4 gates, Sister Vicky and I, we guys as clients that we have, we're not acupuncturists, so we can apply the needles on people, but we have something really, really amazing in our arsenal. We have the 4 gates, a placement of 4 gates, and Dr. Kristine showed you where you put them. So as you massage your finger with your other
basically hand, if you just do this, you got to get into that webbing. When your finger lands on that point, look how that's where your patch goes.
Wow.
You will feel it. It's a sensitive point.
So it's right, white on right and tan on left, right?
Right.
And you do also on your feet at the webbing of between your first and your second toe, right?
Right.
So that, guys, will open up your 4 gates, just like she does it with the needles. We can do that with energy enhancer. Now, would you recommend to do it with, if people have pain, with the ice wave?
Yeah, so I would do the ice wave on the hands, and I would do the energy on the feet.
Okay, great. So you guys are getting a treat right here. So when we do that, then the patches have an almost immediate, you would say, right?
Yeah, definitely. I would keep those patches on there, and then let's say if you're going to work on their neck or their head or whatever, then just do additional. It is additional patching, but it works like a charm.
And this is another point that I think Brother Roy had shared with you, that you really don't have to put the patches on the person's body. You could put it over their clothes, and you don't even have to take the stickers off, right? So
I just use a medical tape over it.
Okay.
So I don't know why, but I like it directly on the skin. It just makes a better effect, in my opinion.
Sure. So that's awesome. So guys, I hope that you got that. If you don't, ask me some questions later, because Sister Vicky and I, we use that all the time. But just be ready. Like when you're patching somebody, don't just necessarily say, I'm going to put a whole bunch of patches, and don't tell them what these costs are going to be. Let them know there's a cost involved in this. Are you prepared to pay 20, 30, whatever you charge it for each patch, so that they can tell you, yes, I'm prepared to pay it. If they don't have any cash or they have a credit card, though, you're prepared to receive that payment. So don't just start putting patches on people thinking that they're going to go, okay, thank you very much, I'll see you later, I'll never see you again, because I'm already I'm already helped, right? So just keep that in mind. And my camera did a little wacky thing because I have gestures that it recognizes what I move, so it's kind of weird. So anyhow, you want to go continue moving to the rest of the clients that you had? All right. So talk to us about your favorite patient here.
This is my favorite patient, one of my favorite patients, but right now he's my favorite. So this young man, he's actually 51 years old right now. He had a massive cerebral stroke the day the country went into shutdown. So needless to say, he had a stroke, went into the hospital, and was put in induced coma for a year because nobody could see him. Nobody wanted to do anything at that moment. So they thought it'd be a fabulous idea to put him in an induced coma and then deal with him after the whole COVID situation died down. When they woke him up and he was trached and everything, when they started, the family started advocating that we need to come in, the family did not see this man for months because of COVID, months. That this gentleman had no idea. And it was kind of good for him that they put him in an induced coma, because can you imagine being awake, not knowing what just happened to you and not seeing anybody you love? It's an absolute disaster. So he was in an induced coma for a very long time, but when they decided to bring him out of the coma, they brought him out and they realized that the stroke is so severe. He had become almost a quadriplegic. He was able to sit up, but he had lost function of his neck and both his arms and legs, and speech, the ability to swallow, the ability to open and close his mouth properly. Just a really, really sad situation. So this patient, his mom made an appointment at my office for him. When he came in, this is not what I was expecting, to be honest with you. And it was really difficult for me because I didn't know how to help this patient at all. It was a challenge for me because I couldn't lift him to put him onto a bed. I couldn't roll him to treat anything. I just couldn't treat him, I was very honest with the family. And I said, I think this is out of my league. I just don't know how to help this gentleman. And then it hit me. And I said, are you guys willing to try something new that he hasn't done already? So he's been out of the hospital for 1.5 years, and he's been doing a little bit of physical therapy, a little bit of occupational therapy, and speech. This physical therapy has helped him a little bit with muscle tone and muscle strength, but overall, not a great difference. And so the family was getting desperate, and they were just willing to do whatever it takes to get him to a little bit better. Mind you, this man has a 5-year-old son, and the son hasn't seen him since he was 2 years old. The son hasn't seen him as a healthy father. He's only seen him in this chair where he's pretty much unable to lift his head. When I met him, this is how I met him. This was our first day encounter. So I figured I'd work on his face with the needling, because that was the only place I could really needle. I did the 4 gates on him. And then I said, I'd like for you guys to try this product. And they said, fine, let's do it. So I introduced the product that first day, and I gave him X39 the first month. All he did was X39. Remember, this gentleman can't speak, so I don't know what he's feeling. I don't know what he's thinking. I don't know how he's responding. So I saw him in between a few times, and then I decided to put him on the cellular regeneration for severe symptom for 5 days. And then we did the cellular regeneration program 3 times in a row. So this is after the first month of cellular regeneration. Now, if you notice, he's sitting straight up. His head is up. His wife is still holding his head up, but he's up. I mean, there's already a shift happening here. So all I was doing is just working on his face. This is, and I've asked the family to try to put him in the similar clothes every time, so we don't see a differentiation. I just said, let's make this as acupuncture clothing, so we know. So this is the 3rd month of patching, and now he's able to hold his head up. His head is completely erect on its own. There's no help. A little bit of pillow support in the back, but even without the pillow, he's able to hold his head up. He's now moving his hands at this point, moving his feet. And again, I'm doing 4 gates every single time, and then additional acupuncture on his head for the brain and the face. And then, so this is the 4th month. Now I hadn't seen him because he got COVID during that last picture and this picture. He handled COVID like a champ. I mean, we patched him with COVID placements. We did all of that. Plus I had he has a G tube because he still can't eat very well. So I was having the family put lots of supplements and herbs into his G tube and just feeding him everything his body really needed nutritionally without overbearing him with pills and stuff like that. This is incredible. I mean, he is incredible. If you, Pastor Ed, go back to the picture before this, go to the first and second pictures really quickly. I want to point out something. Go to yeah. So if you look at this picture, look at his forehead. This is where you're going to see the huge, huge difference. There is no muscle tone in the forehead. It's completely flaccid. Now, if you go to the next picture, every picture you start to notice that there's beginning muscle tone in his forehead and his face. The face is completely shifted as well. Now go to that third picture and you start seeing these lines. I don't know if you can see it right above his eye. There was no lines before. Now muscle is growing. So now we have muscle tissues, and his wrinkles are coming back in a good way. That's just showing us he's capable of moving those muscles now.
Wow.
And if you go to the next picture, this is a month. Look at that. Huge, huge difference. His hair got thicker and fuller. His face, look at his eye. Look at the way his eyes opened up. And the other eye's shut on purpose. The physicians have sutured it up so it doesn't dry up because of the loss of tone in his eye right now. But eventually we're going to have that eye open too. But if you look in the mid center of his forehead, you can see how the muscles are changing. Yes, you see that, how it's starting to now go and affect the other side, which was the greatest effect from the stroke was on the other side, on his left side. This was, I think, a couple of weeks ago. So if you go back to the previous picture. So this was 2 weeks ago. And look at that. Do you see how it's changing every single time we see him? There's a drastic change in his face. Even his skin has gotten much more pinker. The color has changed. The elasticity of his face has changed. And like the muscle tone is completely beginning to start to function. Now, we're also, at this point, I'm doing a brain protocol on him. And I'm using a lot of just points that I would use in acupuncture, like the 4 gates. It's on him every single day right now, plus the brain protocol, plus stroke protocol together. That was last week. And this week, we started the facelift protocol on him. I stopped the brain protocol for now, and now we're doing the facelift. And already, so I placed these on him because his wife had come and put them on and they weren't that great. But do you guys see this change in this man's face? I mean, it's incredible. He just makes me super happy every time I see him. I'm just so happy for this family. And then I don't know if Pastor Ed, you can share that video that I had with him the other day. Just remember, this man was unable to sit up, unable to move his hands up or down, unable to communicate. And now he tells me things he wants to eat, things that he, we're trying to work on his chewing right now and be able the function of swallowing. So I'm doing a lot of acupuncture in the head and then the mouth and there's the throat area. But he's got a tenacity like no other. He's incredible. So go ahead and play the video, Pastor Ed. So I'm asking him to touch me, like touch my face, touch my nose. That was one.
Hi, Hovik.
Not very nice. You don't.
Put your head up. Yeah, thank you. Move right, left. Yes, amazing. Now, can you touch my nose? Yes. Come to me, come to me, come to me. Yes. Perfect. Can you, Hovik, zit het weer coming? Yes. Nu
I'm
stil.
asking him to raise his hands.
Yes. Very good. Very good. Very good.
Yeah, so I'm just so happy with his results, and I just can't wait to see what's gonna happen to him next year. Yeah,
Good.
he makes me happy, he makes me cry, he makes me do everything. I mean, every time I look at him, I start crying, and his wife is like, why do you cry so much? I'm like, I can't help it, it's so joyous for me.
So when he
Yeah.
comes in, do you you apply the patches, right? You apply
After
the different-
I'm done trading.
after you're done treating him. So does he go home with those patches and
Yeah.
then his wife puts them on?
So his wife finally signed up as a distributor. I was begging her. I'm like, can you please stop buying it from me? Like, you're gonna need this product, because she doesn't want to deal with, she's got her hands full. She's like, I can't do. I'm like, listen, it's okay for me to make this commission, but I want you to be able to afford this long term and get him the care that's above and beyond anything, and that look how well we're doing. I don't want you to get to a point where you say, you know what, I'm all out of money. I can't afford this anymore. So and I told her from the very beginning, this is going to be a very long journey. I don't have any other patients with a stroke that I've patched like this before. We're learning together, but if we see no progress, then we stop. But as faithful as God is,
That's awesome.
Yeah.
I'm so happy that you share this. And
Yeah.
if you have time, Dr. Kristine, I want to respect your time. We can talk about
No,
the
it's
other
fine.
ones. You're okay?
Sure. Yeah, I'm okay.
Okay. So let's go ahead and talk about your other, you sent me a couple more videos here.
Lisa.
She's funny.
All right, so you want to tell us a little bit about her?
So this patient, she was a new patient to me, and I usually, like I said, I don't ever talk about patches, but you can just tell some people are ready to receive new information. So I met her for the very first time. I did acupuncture on her. She was feeling good, but not great. She wasn't completely pain-free. I mean, her pain had gone from like a 9 to a 6 or 7 already. But she was just really full of life lady. And so I really wanted to like introduce this product for her. It was just like, she needs to know. So I introduced it. I said, let's just try, you have nothing to lose. And so we did. Is this a video, Pastor
Yes.
Ed? I don't remember. Yeah. Oh, okay.
First time patient. She came in for a knee pain, but
Oh,
we
knee pain.
decided to patch her lower back because she was having severe lower back pain. Lisa, can you tell me what happened? What's going on?
Since you've applied these patches, I am more mobile. And this is no BSing or anything. Literally, I was very stiff because I suffer from rheumatoid arthritis. Since I've been patched, I'm getting up better. The neck is feeling better. I can turn left to right, right to left, but my back is amazing. I suffer so much back pain that these little patches, I feel something happening back there, but I can't explain what it is. Whatever it is, I'm so happy.
How's your knee doing?
My knee, I forgot about my knee.
Isn't that amazing? You were like in a lot of pain.
Oh my God.
Yeah.
That's so weird. Oh my goodness.
So we
Because
patched Lisa with an Aeon patch.
oh, my shoulder.
And then we did.
Oh, and
we're
my
still
back.
sampling, and we did her lower back. We just wanted to test it and
my
see how she was
goodness.
doing.
Look at watch me bend. I couldn't do that before.
That's incredible.
Now I can go home and vacuum.
Well, I'd like for you to go home and relax.
Oh, but I have so
back.
much energy.
I know. Awesome. Thank you, Lisa.
Oh my God.
That's awesome.
She's so cute.
That's
By the way, she's one who's never come back because she just orders patches.
Wow.
That was the first and last time I saw this lady because she was just so overwhelmed. It was just a one-time patient anyway. It was like her lucky day to be there and to be introduced to these patches and just be happy. I'm happy for her.
That's great.
Yeah.
Do you want to talk about this patient of yours?
So this patient of mine he's actually a veteran. And this guy, he was poisoned during the Iraq War because of the bunker that he was in. What is that inject? Something orange. What is it that they gave the veterans?
Agent Orange.
Agent Orange. So he was one of the first recipients of Agent Orange, and it basically fried his entire thyroid. Okay. So this guy he got thyroid cancer, had to have his thyroid removed, and he's been in severe pain since then. So he came to me for his shoulder pain. And, this was already like our 5th or 6th visit. He was doing okay. He was doing good. He was recovering really well from he had like surgery in his shoulder, and he had so much scar tissue that, sometimes you can tell when you put a needle in how much scar tissue is in there. And like, I would put a needle in, I'd have to go like, my God, I can't get through that scar tissue. So eventually I introduced the patch to him, and he was in awe. Yeah, he was he just felt so much better.
Robert?
So weird. It doesn't hurt anymore.
So Robert's shoulder has been hurting for how long?
Since May.
Since May. This is the first time I'm seeing Robert, and we just tested the Lifewave on him and the Aeon. Now, before we started, he said his pain level was at a 7. What are we at now?
I mean, I literally don't feel any pain whatsoever.
Incredible. Thank you, Robert.
And then
He's
we
a
have,
really sweet gentleman.
that's awesome. And
I
has he
love
come
my
back?
patients.
Has he come?
Yeah. He comes back.
All right, so we have one last one.
Oh, this was just a few days ago. He's such a nice man too.
Okay, this is a Spanish brother, I can tell.
He's awesome. Well, 90% of my patients are Spanish speaking patients. Yeah.
Yeah, I love it when you call me and you're like, can you talk to this patient in Spanish? Because he knows no English at all. I'm like, sure. Yeah, I love it. I feel like I'm doing the world a favor, right? Using my
do.
language.
You definitely help me, that's for sure.
All right, so let's.
Hi. So George just had a lecture with me, and he was continuing to have neck pain. So I did a quick patching with him. Turn around, George, show us your patches. So tell me what happened. Tell me what your pain level was before we started.
It was a 7, 8, and then it went down in a couple minutes to 3, 4.
What are you feeling right now? Move around for me a little bit more.
Wait,
He was
I
unable
can-
to move these.
I can move
earlier.
better.
Yeah,
Yeah, I can turn way better.
awesome. Thank you so much.
All right, so we
Way
have
better.
last video.
So I just moved his patches around because he was having some radiating pain to the left side. And now tell me what you feel now, George.
I can move way better. It feels way better.
Amazing. Right?
Yes.
All right. Awesome.
That's incredible. That I know that touches your heart, Dr. Kristine.
It does. It really does.
And I just want to thank you from the bottom of our hearts. I know that
My
we
pleasure.
appreciate you getting on the call. And I know this has taken a lot longer than we thought, but you know what? We
That's okay.
really appreciate you taking your time.
Oh, it's okay. I'm here to help you guys anytime.
So guys, I'm going to stop the call, but you know, if you have a few minutes, we'll ask you a couple of questions. So till we'll see each other again, guys, God bless you, and we'll talk again.